Hello, welcome to today's webinar. I'm Phil Buchanan, president of the Center for Effective Philanthropy. The title of our webinar is New Realities, New Data, Nonprofits in Crisis, and What Donors Need to Know. But we're going to be sharing new research from this report. You're looking at the cover, called Funder Support During the COVID-19 Pandemic. Nonprofits are operating today in an unparalleled crisis, a global pandemic. They are also themselves in crisis, as the data we'll share with you today makes clear. Nonprofits are also operating in a context in which the already marginalized and oppressed and targeted members of our society are being massively, disproportionately impacted by an unparalleled health and related economic crisis. The racism that is embedded in this country's history, dating to slavery and the genocide of indigenous people, is manifested every day in police killings of African Americans, in infection and death rates from COVID, that in the case, for example, of the death rate for Black Americans is twice that of whites. An economic crisis with a hugely disproportional negative impact on immigrants and women, as well as Latinx people and African Americans. And of course, virulent racism, frequently stoked by this White House, directed at Asian Americans and others. This is where things stand on June 8th, 2020. And of course, we're all affected by this crisis. But some among us are suffering disproportionately, and it is the very people who have faced barriers and oppression from the beginning. And I think this is not hyperbole, this is reality. This is the context we're living in, and this is the context that nonprofits are operating in. This is the context in which donors, and we have well over 500 donors, both institutional and individual donors, with us today, and we're so glad that you're here. This is the context in which donors need to make decisions about how to be most effective. So that's what we'll try to focus on today. On the context nonprofits are working in, the challenges they face, whether they're working directly on the kind of issues that I alluded to, or more indirectly, whether they are direct service or performing arts organization, whether they are local, national, or international. Nonprofits play an absolutely crucial role in our society. And they're showing remarkable skill and resilience in this time. And they're facing incredible challenge, and they need support. So we have a terrific lineup today, and we'll be bringing as well your questions into the conversation. Our panelists, who we'll hear from in a few moments, include Chitra Hanstead, Executive Director of World Relief Seattle, which has worked with since 1979 to serve and help refugees and immigrants in the greater Seattle area. Prior to her role at World Relief Seattle, Chitra spent time in India consulting for Justice Ventures International, an anti-trafficking organization, on strategic planning and fund development, and she has also been a philanthropic advisor for the Seattle Foundation. Stephanie Hall has joined us. She's the president and CEO of Girls Inc., which inspires all girls to be strong, smart, and bold. Their programming in partnership with schools and at their centers in, I think, 82 different locations focuses on the development of the whole girl through a combination of long-lasting mentoring relationships, a pro-girl environment, a research-based programming that helps girls to lead fulfilling lives, break the cycle of poverty, and become role models in their community. And I'm pleased. I've known Stephanie since I think we were both in our late 20s, and I'm pleased that she's a part of our program today. Also pleased that Melinda Twan, someone I've also known for decades, the managing director of the Fund for Shared Insight, is here. That's a national funder collaborative working to improve philanthropy by elevating the voice of those least heard. She's also an independent consultant to the senior leadership at philanthropic organizations around the country, and she promotes, crafts, and implements strategies for effective philanthropy. I'm not doing justice to any of these bios. She's had a number of other leadership positions in the sector. Before we turn to these three philanthropy and nonprofit practitioners, however, I want to turn to my colleagues who will share data from the survey that I alluded to that we conducted just last month on what nonprofits are experiencing right now. Like, we know there have been lots and lots of surveys conducted, but ours seeks to be nationally representative rather than just based on a convenient sample, and also to really probe what it is nonprofits need from donors right now. I think it's only with an understanding of where nonprofits are, their reality, that donors can effectively respond in this moment. So the data that they'll describe, again, are from a report that we will release tomorrow. You will get a link by virtue of having signed up for this webinar, both to the recording of this webinar tomorrow and to the report. So my colleagues are Hannah Martin, who's an associate manager on our research team here, and Kate Gelling, who is an analyst on that same team. But before I turn it to Kate, just a few housekeeping notes. We are in a webinar format, which means all of you are muted and have your video off upon entering the session. If you have questions for the panelists during today's presentation, and we hope you do, please type them into the Q&A box in your Zoom control panel. We will try to be responsive to as many questions as we can. We will not be using the hand-raising function in the webinar. If you require technical assistance, please reach out to my colleague Molly Heidemann. She's at mollyh@cep.org, and she can help you. This webinar is being recorded, and like I said, there'll be a link sent out. So at this point, I would like to invite my colleague Kate to tell us a little bit about the survey we conducted and what we learned. Kate?
Thank you, Phil. Before we get into the research itself, we first wanted to thank the Fund for Shared Insight for really generously providing the funding to support this research project. As Phil said, when we were beginning to develop this research project, we saw that there was a lot of data about how COVID-19 is affecting nonprofit organizations and the people they serve. But we felt like there was something missing. Data about how funders of nonprofit organizations, such as foundations, individual donors, and major donors, are supporting nonprofits in this moment, as well as what nonprofits will most need from their funders moving forward. We also wanted to provide data that's representative of the nonprofit sector and organizations of varying sizes, geographic regions, and issue areas, so that we could paint an accurate picture of the diverse experiences of nonprofits in the sector. That led us to 3 different research questions. First, how have nonprofits and the people and communities they serve been impacted by the COVID-19 pandemic? Second, how have staffed foundation funders and major donors responded in support of nonprofits during the COVID-19 pandemic? And third, going forward, what do nonprofits most need from their funders? To answer these research questions, we fielded a survey of our Grantee Voice Panel. CEP developed the Grantee Voice Panel about 8 years ago to provide nonprofit data that's representative of grantees of large US-led foundations by organizational size and geographic region. To that end, the Grantee Voice Panel is a rigorously developed national sample of CEOs of nonprofit grant-seeking organizations that have received at least 1 grant in the last 3 years from foundations giving $5 million or more annually. We sent the survey in May to 595 CEOs on the panel and received responses from 172 for a response rate of 29%. Much like the panel itself is representative of the nonprofit sector, the respondents to this particular survey are also representative of the sector by annual expenses, staff size, and geographic region. So we feel confident that the data we're about to present is representative of the sector. In the survey, we wanted to learn about how nonprofits are experiencing support from their foundation funders, individual and major donors. We defined major donors in the survey as individual donors who give $7,500 or more to the respondent's organization in a given year. This threshold is based on CEP's previous research in 2019 that was released in our Crucial Donors report. So if you want to learn more about the threshold we used in this survey, you can find that report on CEP's website. With that, I will turn it over to my colleague Hannah to present the key findings from this research.
Thank you, Kate. From the survey, we drew 3 key findings. 1, while COVID-19 has had devastating impacts on nonprofits, the negative impacts have been magnified for nonprofits that provide direct services and serve historically disadvantaged communities. 2, during this time, nonprofits that rely on foundation funding are experiencing fewer negative impacts and more stable funding than those relying more so on earned revenue or gifts from individual donors. And 3, while staffed foundation funders and major donors have been helpful during the pandemic, major donors are significantly less likely to have talked with nonprofits that are led by women about how they will support them in the future. Let's dive deeper into key finding 1. Nonprofit organizations are struggling. Most leaders say that COVID-19 is having a moderate or significant negative impact on their organization. And the impact of COVID-19 differs by the type of work the nonprofit does. Leaders of direct service nonprofits rate the negative impact of COVID-19 significantly greater than leaders at non-direct service nonprofits. 54% of direct service nonprofits rate the negative impact as significant, compared to 29% of non-direct service nonprofits. Nonprofits are taking a variety of actions as a result of COVID-19. For example, 90% of nonprofits had to or expect to cancel or postpone fundraising events, and most also report that they have or will reduce programs or services, draw from reserves, or reduce staff hours, wages, and/or benefits. Fewer, but still a substantial number, have had to or expect to lay off and/or furlough employees or take out a line of credit. Let's talk a little bit more about reserve funds in particular. Before the pandemic began, 82% of nonprofits had reserve funds, and half of these nonprofits had 4 months or less of operating expenses on hand. At the same time as many nonprofits are having to take actions such as reducing programs or services as a result of COVID-19, over half report they've experienced an increase in demand for their programs and services. The community served by a nonprofit influences how much of an increase in demand they have experienced. Nonprofits that primarily serve historically disadvantaged communities are more likely to have experienced an increase in demand. 61% of nonprofits that primarily serve historically disadvantaged communities have experienced an increase in demand, compared to 35% of nonprofits that do not primarily serve historically disadvantaged communities. To better understand and learn from the people and communities they serve, nonprofits need to listen to and gather feedback from them. They are most commonly doing so in 2 ways. 1, direct communication. One leader describes speaking to customers every single day. And 2, surveys. One leader describes conducting a COVID-19 assessment on a weekly basis. From their conversations and surveys, nonprofits have learned about the challenges facing those they serve. They are most commonly facing 3 challenges. 1, financial security. Many of nonprofits' constituents have lost their jobs. 2, food security. Food banks are stretched to capacity, beyond what they've ever seen. And 3, mental health. When people are struggling to survive, it's hard to prioritize mental health. Nonprofit leaders are facing their own challenges as well. They're most commonly facing 3 challenges. 1, supporting staff well-being. One leader describes balancing the anxiety and needs of staff and the enormous demands on their organization. They say they're in their 60s and have been in leadership roles for 30 plus years. It's never been this hard. 2, financial security. They're struggling to find funds to keep their organizations afloat and their staff employed. And 3, decision-making in the midst of uncertainty. They have to react positively to circumstances that change on a dime. Now let's turn to key finding 2. During this time, nonprofits that rely on foundation funding are experiencing fewer negative impacts and more stable funding. Revenue from staffed foundation grants has been more stable than revenue from other sources. 30% of nonprofits say that grants from staffed foundations have decreased, compared to 43% reporting a decrease in gifts from individual major donors, 51% reporting a decrease in gifts from individual donors below the $7,500 per year giving level, and 77% reporting a decrease in earned revenue. Nonprofits' major sources of funding matter when it comes to the impact of COVID-19. Organizations that say that the biggest portion of their revenue is comprised of grants from staff foundations have been less negatively impacted by COVID-19 than organizations that depend on other sources of revenue. For example, 26% of nonprofits that are largely funded by grants from staffed foundations rate the negative impact as significant, compared to 52% of other nonprofits. And finally, let's turn to key finding 3. While staffed foundation funders and major donors have been helpful during the pandemic, major donors are significantly less likely to have talked with nonprofits that are led by women about how they will support them in the future. Overall, most leaders report that their staffed foundation funders and major donors have been somewhat or very helpful to their organizations during the pandemic. Additionally, nonprofits led by CEOs who identify as people of color rate their staffed foundation funders significantly higher on helpfulness than nonprofits led by CEOs who do not. 52% of nonprofits led by CEOs who identify as people of color rate their staffed foundation funders as very helpful, compared to 29% of nonprofits led by CEOs who do not identify as people of color. CEP's previous research has shown that funder-nonprofit relationships matter, and a key component of relationships is communication. Since the pandemic began, over 80% of leaders say that at least some of their staffed foundation funders and major donors have made direct personal contact with their organization. Most also say that at least some of these funders have talked with them about how the pandemic is affecting the people and communities the organization serves, and about how the pandemic will change the way they support the organization in the future. On the next 2 slides, I'd like to share some differences in how major donors are communicating with nonprofits by community served and by CEO gender. Major donors are significantly more likely to have talked with nonprofits that primarily serve historically disadvantaged communities about how the pandemic is affecting the people and communities they serve. For example, 17% of nonprofits that primarily serve historically disadvantaged communities report that none of their major donors have talked with them about this, compared to 39% of nonprofits that do not primarily serve historically disadvantaged communities. And major donors are significantly more likely to have talked with nonprofits that are led by men about how the pandemic will change the way they support them in the future. 17% of nonprofits that are led by men report that none of their major donors have talked with them about this, compared to 53% of nonprofits that are led by women. Now I want to talk about staffed foundation funders specifically for a couple of slides. 72% of nonprofits report that at least some of their staffed foundation funders have allowed the goals of current grants to shift, and most also report that at least some of these funders extended the deadline for completing the work funded by current grants, waived reporting deadlines or made them flexible, proactively converted restricted grant funds to unrestricted funding, provided supplemental grants, or offered to discuss converting restricted grant funds to unrestricted funding. Fewer report that at least some of their funders have accelerated payment schedules on grants, increased the size of current grants, or automatically renewed grants. What's especially important to note here is that for all of these actions, few leaders report that the majority of their funders have taken these actions. Going forward, nonprofits most need their staffed foundation funders to take 3 actions. 1, provide unrestricted funding. This allows nonprofits to focus on their mission instead of fundraising. 2, provide more funding. They urge foundations to stop protecting endowments for the future. The future isn't going to matter for so many if they don't get the support they need now. And 3, reach out to nonprofits, especially to provide transparency about how the pandemic will impact future support. And going forward, nonprofits most need their major donors to take 3 actions. 1, provide more funding. They urge donors to give with a mindset of plenty instead of a fear of less. 2, reach out to them, especially to provide transparency about how the pandemic will impact future support and to express care. And 3, provide non-monetary support, especially fundraising assistance. I'd like to conclude by sharing some implications of this research. Nonprofits are struggling, especially those that provide direct services and serve historically disadvantaged communities. And while funders are helping, there's a lot more they can do. So, funders, provide more funding if you are able. Nonprofits that rely on foundation funding are experiencing fewer negative impacts, likely because this funding has been the most stable. 2, provide unrestricted funding. This type of funding gives nonprofits flexibility to handle needs as they arise. And 3, reach out to provide transparency about how the pandemic will impact your future support. Nonprofit leaders are finding it extremely challenging to plan for the future, at least in part because some funders are not communicating their plans. In particular, leaders who are women report that this is the case. And with that, I'll turn it back to Phil.
Thank you so much, Hannah and Kate. And I also want to thank my colleague, Ellie Buteau. I want to invite our 3 leaders to turn their video on and join me here. As they join, I just want to acknowledge again the 3 colleagues that I mentioned who turned around the results of this survey to the report that's going out tomorrow in a matter of weeks because we thought the data was really relevant and timely. Chitra, I want to start with you, just reaction. What do you make of what you heard, and what is your own perspective on what you're experiencing?
Thank you, Phil, for this opportunity to participate on this panel with you and these amazing women leaders. World Relief Seattle is the largest refugee resettlement and services agency in Washington State. We welcome, root new refugees and asylees and serve any immigrant who's in need in our community. And over the 40 years that we've been here, we have welcomed over 40,000 refugees and provided vital services for thousands more immigrants. Even before COVID, we were in an existential crisis because of this administration's policies towards refugees and immigrants. Our largest revenue source, earned income from the government, has gone from significant under previous administrations to a trickle under the current administration. And with COVID, it has gone to 0. Meanwhile, needs in our community have increased drastically due to the pandemic. COVID is hitting communities of color, as the report mentioned, disproportionately in terms of unemployment, health, housing stability, and food insecurity. Responding to the need, we've partnered with Northwest Harvest, a large food bank, to establish a temporary drive-through food distribution site in a church parking lot. We feed an average of 750 families a week by distributing food boxes that last for 4 days, as well as other high-ticket items like diapers, baby formula, feminine hygiene products. Items, if bought in a store, would cost as much as $150 a month. Our employment team is overtaxed with hundreds of people needing to navigate the unemployment system, and they want to seek new employment. Many of our clients had been working in the hospitality, travel, or food services industries, which, as we know, are devastated by job losses. We also serve detainees and asylees at the largest immigration detention center on the West Coast, It's in Tacoma, Washington. Our legal clinic is working hard, but due to the closure of government offices, people are unable to receive crucial papers like social security numbers and work permits. And this phenomena of under-documentation is leading to people being released from that detention center with no way to secure a job or an apartment. World Relief is there to help with basic needs and pro bono legal help. A refugee youth summer academy will still happen with virtual classes because our immigrant kids are falling further behind with homeschooling during COVID. Yes, food distribution is important. It meets urgent needs, but our aspirations go beyond those types of needs to build longer-term resilience for marginalized communities. Through future projects like an entrepreneurship academy, job creation through commercial and teaching kitchens, academic support, and employment readiness, we hope to remake the system. In light of the last couple of weeks in our country, we need to ask the deeper questions like, why is it that the same communities are in food lines every time a crisis hits? Now is the time to invest in systemic change. Now is the time for bold, disruptive philanthropy. As an immigrant myself, I resonate with World Relief's vision statement. It says it all. Every immigrant and refugee welcomed by community, rooted in community, and empowered for community. Thank you so much. Thanks, Phil.
Thank you, Chitra, so much. And we'll get into some of the topics that you raised in our conversation. I just am so impressed by the stories that I keep hearing of nonprofit leaders who are responding creatively to something beyond what could have been imagined. And it absolutely, and I say it because yet I continue to see the sort of condescending attitude that some have toward nonprofit leaders, as if they weren't so talented, and as if running a organization like yours doesn't take everything it takes to run an equivalent sized business and then 100 times more. So thank you. Stephanie, let's bring you in. What do you make of both what we heard and then your own experience over these recent weeks and months?
Thank you, Phil. And I also want to add my thanks to Chitras for the chance to be part of the conversation. As you said earlier, Phil, Girls Inc. is an out-of-school time program. We serve about 135,000 girls through schools and centers, and we do that through a network of affiliate organizations. And both the national organization and each of the affiliates is its own separately incorporated 501c3. The majority of the girls we serve are from families of color and low-income families whose income is below $30,000. And as many have commented, these are the populations that have been hit hardest, first by COVID-19, by the events surrounding the murder of George Floyd. A lot of the parents employed in sectors in which working from home wasn't supported. A lot of them are first responders or transit workers, healthcare workers, food service professionals who were out in direct contact with the public, even as safety measures and best practices were being debated. So if they did get sick, they were also in a group that was less likely to have solid healthcare and good options for that. Most of all, I think it's important to note, because we work with girls in particular ages 5 to 18, these people are facing extraordinary challenges just doing the job of parent. Because they had no school, they had no daycare, they had no after-school programs to support them. And the girls that we serve are, and as many children are in these communities, are bearing the brunt of this. We have concerns about their mental health, their well-being. We have concerns about learning loss that happened when school and other learning opportunities left them abruptly. We have concerns about their optimism and resilience, because in that world where all of that happened, we've also seen adults really throw up their hands and say, you know, it's just chaos, it's a failure. So it's a challenge. And the other thing that is worth noting is that we are serving communities that now have significantly greater needs, but for all the reasons we discussed earlier, we're having to do more with less due to our budget cuts. Our budget is dependent on a number of sources, not just foundation support. So the sectors that are less resilient made up a significant part of the income that we needed. And just to give you an example of things that cost extra, our facilitators who used to work with girls are now working with parents too, to try to help the parents help the girls. We used to do snacks and food distribution at our centers. Now we're doing it for whole communities in many cases because we had a location where that could take place. I think we pivoted very quickly and effectively so that we could connect with the girls, but now we're even caring for some children or first responders who weren't part of the program. So we work with giving, that is individual giving, corporate cause marketing, events, and foundation support. Cause marketing would be in the form of proceeds from an in-store event or something like that, that obviously is really falling apart right now. Events, about 6% of our budget would have come from gathering in a large crowd to have a gala or a luncheon or something like that. And then you all know that this is a place of dramatic uncertainty, so we have had to revise our hopes for support. We were the beneficiaries of a PPP loan. We were able to retain our national staff. We were able, with a pay cut, basically, to retain our national staff and support our affiliates that way. We decided, rather than using our own reserves to preserve our status quo, we took a pay cut and we created emergency relief funds to support the network, which was an unprecedented decision. National flows through fundraising to the affiliates, but we have never before given our money to them. But that was something we decided we needed to do. And we've also announced the establishment of a fund for resiliency, and Phil and I wrote about this to try to encourage people and incentivize them to create the reserves that would have needing to dip into the nationals reserves, because overall the network's $100 million budget. It's next to impossible for us to retain the kind of funds that would make a dent in a 1 or 2 month delay in ability to raise money at each of those affiliate levels. And of course, this has only been compounded by the disruptions that have happened when George Floyd was murdered, the communities that we're in, the streets that we're on, where the protesting turned into rioting and the grocery store was closed down and the community center couldn't open its doors for fear of looting and rioting. So in short, I'd like to say that I'm really heartened by the conversation about moving toward funding nonprofits led by women, women of color, serving populations of color. I do welcome those conversations when they start, obviously. And I want to say also that I was grateful to find that our funders rapidly understood that there was some complexity, that they reached out in many cases to talk to us even before we had really formulated requests. And we welcome the chance to be part of a really deep and honest conversation about how to remediate some of this, how we can use our knowledge and our experiences and our good financial and business practices to be reliable investments for some of these new investments that are coming up. Thank you.
Thank you so much, Stephanie. And it was clear, I mean, it was clear almost immediately, I think, as the COVID crisis took hold, that responding effectively to that crisis meant paying attention to inequity, that they were one and the same, that effectiveness and dealing with inequities were one and the same, and for all the reasons that you described. Melinda, you're on the funder side, working with funders, and part of what you're trying to do at Fund for Shared Insight is help funders to not make the mistake that is sort of the great predictable mistake of philanthropy, which is thinking that what others need and then imposing a solution that actually doesn't feel like a solution. What do you make of this moment, and what are you doing as a result?
Yeah, I echo Chitra and Stephanie's thanks. Just amazing to be on this webinar with them. And I'm just so appreciate you sharing the voices of nonprofits and representing women of color who are leading in the field. So thank you. Fund for Shared Insight, as you may know, was founded in 2014, and we're a funder collaborative. There are 13 core funders that comprise the governing body of this group of funders who came together because we saw that philanthropy so often is in its ivory tower and listening to experts and looking at evaluations, but not lifting up the voices of the people and communities who are least heard. And by least heard, we mean people who are using the products and services that nonprofits provide, but also more particularly voices least heard in those who are most marginalized, who have been historically victims of structural racism And those are the voices that we want to elevate because they are the experts in their own lives. And it's their lived experience that really needs to be informing what not only nonprofits do in terms of how they deliver their services, but also how foundations think about partnering with nonprofits and how foundations and donors are thinking about how they give away their money, how they develop their strategy in terms of their grant making. And to date, through our signature initiative called Listen for Good, we have more than 100 funders that have joined us to nominate and work alongside their nonprofit partners. And we've listened to more than 125,000 people across the country, 80% of whom self-identify as being people of color. And it's really important to us that the systematic listening doesn't just stop at the listening. Because we have all been listened to, but then no one does anything with what we say. And that's where we are as a country right now, is people don't feel heard. So it's not enough just to say, I'm listening. We need to act on what we hear. And so the systematic listening, the systematic acting on what we hear is what Fund for Shared Insight is about.
Thank you. And okay, so I have so many questions, but one I want to ask is, we know from the data that the nonprofits that are in direct service and are serving historically marginalized communities are facing the most significant challenges. That's not to say other nonprofits are not facing a lot of challenge, but that the challenge is even greater. And then, you know, we know from other research and certainly anecdotally, the challenges that can face women of color leading an organization, seeking to fundraise. Chitra, I wonder, you and I have talked about this, and I wonder if you wanted to speak to the challenges you face as a woman of color on the fundraising front and more generally.
Sure. Yeah, so, you know, I've been doing this work, I had 2 years at a foundation, but other than that, been in nonprofits for the last 30 years. And you know, one thing that I found out, less than 20% of nonprofit leaders are people of color. And on the flip side, 8 to 9% of grant making dollars from foundations goes into communities of color. And as we've talked, Phil, 92% of CEOs and foundations are Caucasian. So people like me that have lived in and worked in the communities that we serve, marginalized communities, our networks are primarily the people that we are hanging out with every day, the people that we serve. So we don't have too many connections to wealthier donors. And our foundation relationships are hard fought. Most foundations now have gone to this model of invitation only. So if you don't know somebody at that foundation, it's very difficult to have an introduction or be asked to apply for a grant. For example, last week I had a call with a foundation that I'd worked 3 years to just get that phone call. 3 years, just because I don't have those networks. So I had to go through LinkedIn and this person knowing that person, and finally had that call. So it's very difficult. People, you know, in general, give to people they know, and trust is built that way, right? Through social networks. And if you're not part of those social networks, it's very difficult to be in those conversations. So, but regardless of that, we get like amazing gifts from people in the community, just $20 or $50. And those, we just had a gift come in from a person that had been detained at the detention center, and he had gotten a job, and he sent a $500 gift and said, wow, would you please use this to help others? Because I was helped by you. So those kind of gifts just make your day, right? Yeah.
Yeah, that's beautiful. I love that. Stephanie or Melinda, do you want to add anything to Chitra's comment? I'll turn to another topic then, which is as we seek to try to provide, recognizing that the folks on the line right now are people who presumably want to do something to help, and they're committed to doing it, as effectively as they can, or they wouldn't be spending an hour on a webinar. They're trying to learn. One of the things we're hearing is, well, we got to be responsive to, even if you thought your goals were one thing, this will open up your eyes to maybe some things that are different. But is there a danger, Stephanie, for an organization like yours that has been around a long time, doing the work that it does, that you get overlooked as people seek to make gifts to or grants to efforts that feel much like more directly connected to the crisis itself? Are you worried about that?
Actually, I am worried about that. And it's happened twice in the recent months. I think first, everybody wanted to be responsible and doing their part to support people in the wake of COVID. And then obviously in the wake of the unrest following George Floyd's murder. But what happens when people all pivot immediately is that support for the basics doesn't get taken care of. And so, saying that you're supporting people who are receiving some kind of disproportionate harm as a result of COVID meant that our development office had to kind of think about contextualizing the work that we do in the wake of COVID. And then with the George Floyd response, you had to sort of pivot and think, okay, let me contextualize it in the terms of this. And as somebody said earlier, or the presentation said earlier, you want people in my seat to think about programming that best supports girls, not to think about multiple ways of justifying what we do and using words that will satisfy, sort of the need to respond to a particular thing. And the other big piece of it, even if we were we're pretty good at thinking through, in what ways can this be compliant with that requirement. But the bigger conversation is, again, that there are people in these communities that, the affiliate leaders with facilitators work with girls every day. They may know what girls need in ways that I don't, in ways that funding associations don't. And so the most well-meaning thing, I think, is to say here, it's unrestricted, but I need it to be explained in terms of George Floyd or in terms of COVID. But even that requires an exercise at my level or at the affiliate level that takes up a significant amount of time, because I would feel most strongly that the thing that the girls most need is education, access, and opportunity. And I can't necessarily explain that in words as well as I can explain it from the heart. It's, when everything in your world has been taken away by a pandemic, what you need is best determined by the adults who know you and care about you and are looking right at you, not necessarily by, a company that has said, we're going to put all of our funds into the bail fund because that's the most important thing right now. And those, those kinds of emails, we got them from every company we ever purchased anything from or did any business with. It warms your heart to know that people are trying this time to make some kind of really conscious and potentially painful to themselves response and reaction. But then when that goes off to one side and doesn't leave you in a position to help a girl with mental health, it's, you don't want to feel ungrateful for the depth of that response and from the meaning that's behind it. But it ends up being a challenge to continue with the day-to-day business of caring for these communities when we're trying to fit in the thing people are now driving down.
Yeah, thank you. And it's like, on the foundation front, I just think, and there were, as many folks may know, 9 leaders of philanthropy serving organizations that came together and said, foundations, perpetual foundations, if there was ever a time to think about increasing your spending, even as your assets may have declined, it is now. That the opportunity for foundations to be counter-cyclical, but also to be able to balance the need to continue to support the organizations that were vital before and are vital in new ways now, with the need to do things that maybe the foundation hadn't been doing, almost requires, at least for a period of time, a different thought on spending levels, rather than, my observation has been there's this sort of fixation on whatever the peak real purchasing power of the endowment was, rather than at inception, just at whatever the height was, which I think is not actually consistent with sort of what you need to do to be responsible financial stewards, and potentially puts at risk being responsible for mission. Melinda, as you think about this time, what advice would you have for individual and institutional donors? If you had to boil it down to, and I know that this is what you spend some time doing in your life outside your Fund for Shared Insight hat, to 1, 2, or 3 things that donors should absolutely keep front and center, what would it be? And then I'm going to invite my colleagues back so we can take some questions. But what would you just want people to walk away, with real clarity on?
Well, the mission of Fund for Shared Insight is about foundations and nonprofits being in meaningful relationship with each other and with the people and communities they seek to help. And I think the third finding from your study is very illustrative of that nonprofits, we hear from the study, are saying, like, we want funders to be connected. I think it's ridiculous that Chitra had to spend 3 years to get one phone call, which may have been rescheduled. So the idea of being in meaningful relationship with each other and having actual conversations about what's really going on and hearing directly, I think funders really need to hear more directly from the nonprofits and about what's going on in their lives, and also what's going on in the lives of the communities and the people they're serving and how they're being impacted by this time. And I think in the absence of that relationship, whether you're an individual donor or someone on a foundation staff, it's really hard to understand the urgency. In my other work that I do with other donors around individual high net worth individuals, there's just a lot of people that don't interact with people that are very different from them. And so even to have a conversation of what does it mean for your income to go from 400 a week? What do you mean 400 a week? What does that look like? They have no idea, to 0 because you're in hospitality or food service. And you may be undocumented, so you don't have access to the other possible unemployment. I mean, to have conversations, to be in places where you have those conversations. I know for myself, I've really benefited a lot from volunteering at our local food bank, because I sit in philanthropy in my job, and I have my computer and I have access to all these relationships with funders. And yet when I'm at the food bank is when I'm having conversations with people, twice as many people every week, and hearing their stories. And then I can bring that to my work with individual donors and with foundations. So that lived experience, being in relationship with nonprofits and people in communities, is really essential.
Thank you. I'm going to ask Hannah and Kate to rejoin us, because we have some questions that are about the research. But Chitra, did you want to add something to what Melinda was saying? Did I read your body language right, or no?
Sorry, no, I 100% agree. When I was in foundation work, I asked all of my donors, I was a philanthropic advisor, and I would say, hey, get in my car. Let's go into the community. Do you care about women and violence? Let's go talk to women in the community that have actually gone through domestic violence. Let's hear what they want and how they want you to structure your grant. And in the 2 years I was there, I had 3 people that actually got in my little minivan and drove into the community and had those conversations. And for those people, it was transformative. The way they gave, who they gave to, those relationships that they formed were transformative. But very few people, unfortunately, want that kind of a learning experience. I mean, or maybe I just haven't met them yet. But yeah, I was very discouraged, and that's why I got out of foundation work and went back to what I know and what I love, to be in direct service. But yeah, it was discouraging for sure.
And I would just add to that, I mean, so if people can't or don't have those, and you don't want it to be extractive either in terms of oh, let's do a little van tour of the inner city, but then fund leaders, women, men, people of color who are fund the community, who have lived experience, fund those organizations. You know, prioritize your funding for those organizations. And then that's what we're hearing from the report and from the comments from Stephanie and Chitra, is that so few funders, individuals and foundations, give to communities of color. Organizations are led by people of color who are from those communities. So you can do that just doing your research from your comfortable desk, and prioritize organizations that way and prioritize the communities in that way.
Yeah, and I should say Bridgespan and Echoing Green have done some important work sort of documenting some of the differences between organizations led by people of color versus not, in terms of access to funding, levels of reserves, and so on. There's an SSIR article that came out, I believe, last week that I recommend. And then on this topic, we do have a question that Hannah, either you or Kate could maybe respond to, about sort of the statistical robustness, if that's a word, robustness of the data that we have about organizations led by people of color and what we actually know about their experience. And I think it's important to contextualize that, as the data that we have is about organizations that are receiving foundation funding, right? And then there's this whole world of organizations that aren't. But for those that are, can you say a little bit more about this question of, you know, can we actually say anything? Because you did say something in your presentation, Hannah.
Yes, so there was only one difference that showed up as statistically significant in our data, and it was the finding that nonprofits that are led by CEOs who identify as people of color rate their staffed foundation funders is more helpful than nonprofits led by people who are not people of color. So that's the only statistically significant difference we found for this study.
Thank you. And I think as we discussed it, like we were a little bit surprised by that, and you know, one can only speculate about what the reasons might be, including that funders, foundation staff may be in fact paying particular attention to folks who they think might, you know, who might need their support, because we of course had the other finding of those who serve historically disadvantaged populations. Obviously, that's not one for one necessarily organizations led by people of color, but also felt more support. So there may be some real awareness on the part of foundation staff, and then there also may be an issue of expectations in terms of you know, what expectations people come into these relationships with. I'm just real time trying to look at questions. There's a question that someone had about just like, who else has looked into how nonprofits are faring during this crisis and whether there's a plan to repeat this survey at a later time. I would say that there are lots of good efforts by a lot of folks out there, including regional efforts at a lot of different regional associations. Hannah or Kate, I don't know if you want to speak to anyone's in particular that you would draw people's attention to, or the question of whether we will repeat this effort.
Yeah, I can answer that. So some studies that we saw as we were preparing for this study were one by the Nonprofit Finance Fund. There was one, or maybe two, by La Piana. There was one by the Stanford Institute of Philanthropy at JFK University, and also two by Philanthropy Massachusetts. And those are only a handful of examples, but those are a few. And will we repeat the study in the future? It's something that we're considering. We haven't decided for sure yet, but that's definitely something that would be good to follow up on.
We have just a couple more minutes. I want to invite Chitra, Stephanie, Melinda, each maybe in a minute or less. One thing that you would want, and just reminding you again that like we have a real mix of folks on the line, including foundation presidents, foundation program officers, individual donors, you know, with big donor advised funds, as well as individual donors who might be more sort of everyday givers. If you were to communicate just one thing to those folks that they can remember as they leave this webinar, what would it be? And whoever feels most ready can go first of the
I'm
three of you.
happy to jump in. I just really want to say thank you for the chance to have a conversation with you. It is not easy, as Chitra sort of alludes to it. It's hard to get time on your calendars. So the fact that you've given us an hour to be part of a conversation in which we can learn from each other, it's a really important opportunity. We know that we need to be a good investment. We know that the dollars are scarce. A lot of us think that we're ready to answer the questions, and we just really want to help create a fair test, an equitable analysis. And I think that the basis of this really today is just to give us a chance to start to tell you some of the things that we'd like to be evaluated on, and to hear back from you, we hope, what your concerns and goals and hopes and priorities are as well. I think you want the same thing we do. So we welcome a chance to be in a better dialogue about it.
Thank you, Stephanie. Melinda, and then Chitra.
I would say funders, whether individual donors or foundation staff in any way, trustees, look for ways to get proximate to the people and communities you seek to help, and really try to understand and listen to what people are saying, listen to your nonprofit partners and what they're saying about the need for unrestricted support, and act on what you hear.
Thank you. Chitra.
And I would just echo that. It's a lot of fun. Really, the joy is in the work that we do. And we would love to have more co-workers with us on the front lines. We can't do this work without donors and funders. But yeah, invest in those of us that are, that mirror the communities that we serve. We have that proximity. We are listening to the community, and we're designing our programs with them in mind and with them consulting with those programs. We're constantly listening to the community. So yeah, I would just say give more, because if we go away, to bring us back and to reinvent those, to bring back the relationships and the knowledge base that we have, it's going to take a lot more to bring us back than to keep us in place. And our communities absolutely need us now on the front lines. So please, please invest now. Thank you.
Yeah, and I think, we have two great organizations with great leaders that are, a great way for you to get started. I want to say that I believe that as Chitra's anecdote about the $500 gift earlier illustrates, that giving ripples outward, that people who receive turn around and give, and that our society is in crisis, and that our government, certainly at the federal level, isn't just ignoring or underinvesting in the people who most need opportunity, who have been denied opportunity. They're actively targeting them. And it is often nonprofit organizations that are, in my view, heroically in the breach between that government and people who just want to be full participants in this country. So please, I don't think anyone is going to look back later and say, I wish I'd done less in this time. So I hope that these excellent panelists and my terrific colleagues, Hannah and Kate, and the panelists, Chitra, Stephanie, and Melinda, have inspired you to do everything you can in this time. Thank you for spending an hour with us. Look for an email from us tomorrow with the report and a recording of this webinar, and give effectively. Thank you.